antibody testing is a type of blood test that looks for antibodies that are proteins. Antibodies are proteins made by the immune system in response to a viral infection. So they're a marker that the immune system has seen the virus before and has mounted an immune response against the virus. The reason to get the antibody test, there are a few reasons. The first is if you wanted to donate your plasma, so that could be a potential treatment for somebody else. The second is antibody testing on a population level offers us a lot of insight as to where the virus has been. Because remember, antibody testing looks in the past. It tells us which people may have been exposed to the virus and recovered from it. So that helps us to know what parts of our state the virus outbreaks have already occurred in, what parts of the state are still susceptible and naive to having had virus outbreaks, and it helps public health officials plan the response. And then finally, for you on an individual basis, to know whether or not you're positive helps give you some clarity whether that cold that you had back in February was actually a COVID-19 infection or not. But it doesn't ensure that you're immune against it, but it does help you understand whether or not you may already have been exposed and infected. The accuracy of a test is actually a function of the sensitivity, the specificity, which are test parameters, and the population being tested. So it's difficult to come up with an exact number because the population being tested could vary. But the test parameters themselves reveal that the antibody tests are actually quite accurate in and of themselves if they're used in the correct population. So with COVID-19 antibody testing, if you're testing a very low likelihood population, so someone who had no symptoms, someone who's had no exposures, and someone who really hasn't had any chance of contracting COVID-19, and their test comes back positive, it's more likely to be a false positive. On the other hand, if you test somebody who's either had symptoms consistent with COVID-19 or potentially had an exposure to somebody with COVID-19, or somebody who's a frontline worker, like a healthcare worker or grocery store worker, or somebody who hasn't been able to maintain as much social distancing because of their occupation, and their test comes back positive, it's much more likely to be a true positive.